Assalamu alaikum and a very good afternoon. As part of our monthly guest lecture series, we are pleased to have with us Mr. Mohammed Yaseen Loan Saab. He is Joint Director Planning in the Department of Planning Management, and presently he is Chief Planning Officer, Srinagar. I have a long association, especially over COVID times, with him, and he has been very pivotal in COVID containment, especially with establishment of containment zones and isolation centers, quarantine centers, their arrangements, and many more things. And I found it very prudent to have him with us to talk about perspective planning in health sector. We have been dealing with teaching health planning and management, but something which we need to know about in real sense. So I requested him, despite his busy schedule, I wasn't sure enough that he will come up, and possibly this is the first time during our guest lecture programs that I was uncertain whether a speaker will come on. We have with us from our own planning and planning department, Mr. Wahid Rahman sir and Roof Saab. They have also joined us here. Thank you for coming us. We have Professor Saeed Sajjad Nazir Saab, he is Professor and Head Urology Super Specialty Hospital. Thank you very much, sir, for coming us. And I welcome Yaseen Saab. Because this is getting recording, so I won't put other words, informal words here. Thank you, sir. Thank you again. Really, we were waiting eagerly for you since morning, despite your all unprecedented schedules. For last many months, we had guest lectures on experiences shared by one of the senior faculty members who was head of department in this department. Later, he joined SKIMS and was there working as joint director also. Then we had guest lectures on geosensing. Then we had domestic abuse lecture. Then we had one on cyber security, and off late on digital literacy. And now we are moving to some very important topic, which is on perspective planning in health management.
I'm the joint director presently looking the planning sector of Srinagar district. We had been planning so many things. So Salim Saab yesterday, one day before, requested that rather he is a senior fellow also. He told me that we are going for the guest lectures and you will, if you can come. I don't thought that this is, I'll be invited in such with the cream of this, especially JK, the health. We know that our education days. So how hard it was and how it was competitive to appear in these exams, and in which you had appeared and you qualified for this, the prestigious and the noble job. So I'll be starting, I'll straightforward run to my presentation. It will be a quick presentation what we had done, but to give a presentation in the health sector from a person who is, we can call ourselves, to be honest enough and to be blunt enough, that we are jack of all trades and master of none. You people are the masters. But what I had learned from my career, rather, I had been in health. I had been affiliated in different capacities with health, in chief planning officer. Then I had been also OSD, officer on special duty in health department for some time, 2 years. I'd spent with that. So what experience from other departments, the inter-departments, what I had got, I'll be sharing with it vis-a-vis to specific to the health sector. So planning, whenever we speak planning, the word planning, it comes with it is a subjective word. It's a future is involved. It can never be an objective one. It will always be a subjective. I will start with the first slide. So what the actually prospective planning is, prospective planning in health sector. So what I have analyzed it in 3 points, broader points: setting long-term goals, then strategies for improving health outcomes, the delivery of health services. This will include considering multiple perspectives. This again I had shortlisted them in three parameters. That's the patient needs, healthcare provider needs, uski kya requirements hain, broader societal and economic factors. This will also be an extension to, will be covering also in this part the environmental aspect of how it impacts the health sector. So this is prospective planning again, continued. Prospective planning in health also broader socio-economic. That does have an impact. Then environmental factors, which includes the poverty, education, housing, transport, access to healthy food. Then there are two these objectives, rather I can say like that, are the goals, or what we call it mission statements, which health does have. Health services are delivered in a way that is equitable and accessible to all members of the community. Programs aimed at improving health outcomes for specific population. So I had categorized as a whole as a population, then designing the programs for the specific type of target population. So this planning process, this prospective planning, how it starts? It starts with the assessment, rather the gathering data about the current health status, the trends and needs, what we require. Then the stakeholder engagement, involve a diverse range of stakeholders, including patients, healthcare providers, policy makers, community organizers, to gather the inputs and ensure the planning process is inclusive. Whenever we say the word inclusive, it will include everything in the universe. It can be an environment, it can be this healthcare takers, healthcare providers, then the communities, then animals, even animals can be in that, plants can be in the soil, can be in universe, this earth can be in this. This will be a some total of that, inclusive one. Setting the priorities, then we will set our priorities, how it will function, what will be our needs, and those will be setting our priorities, and what prevalence, I can say from purely from health point of view, what prevents diseases, what we are witnessing at the universal level, how they are improving, so adopt the strategies, go for innovations in that sector. Then to develop those strategies, how to achieve them. Then priorities, when we set our priorities, then we develop the strategies how to achieve these priorities, how to set these, and how to reach to these goals. Implementation and evaluation. Later on we will be evaluating them, because we had gone through process, the data collections, the engagements, the priority settings, strategies. Then we will see when we implement them, what is the margin of error and where the corrections are required. Whenever we speak about this, will include our decision making. Whenever we say decision making, again decision making, the process of decision making is a future. That depends upon the future. It involves the future, and it can never be a objective decision. It can be a subjective, with later on a corrective measures are to be taken, so that it has to be more relevant what our requirements, what our priorities are. So then I will be, after these strategizing these things and prioritizing the things, then we will be going to the health outcomes. Health outcomes, as we know, these are the major health outcomes which I had shortlisted with regard to health sector. This is mortality, morbidity, quality of life, functionality, patient satisfaction, health, behavior, economic outcomes. So morbidity and this, what we call it, morbidity and mortality, all of us know what that actually is. I'll be referring to the data which National Family Health Service, I think that study goes fifth, that's there presently in vogue. I'll be referring to that after this. Then the quality of life, quality of actually life is, this is sense of satisfaction, sense of level of satisfaction what we have in our daily physically, mentally, or emotionally, what that is. Then our functional day-to-day, what we are doing in day-to-day life, like walking, like any other activity which we do on day-to-day basis. Then patient satisfaction refers to such a thing, that the level of satisfaction of a patient from the service, healthcare which he has received, what had been his level of satisfaction. Then there is health behaviors. Health behaviors will be like that, how this psychological or behavioral aspects are addressed, like this, what we call it, diets and other things. Then economic outcomes. What had been the outcome of this? What we call it, the money spent on the services which we had done. What had been its impact on a person, on the family, or on the whole population. So this is our accomplishments till date. I'll be referring to the state. Somewhere I will be referring to the state, somewhere I will be referring to Kashmir province in the achievements, and somewhere I will be referring to Srinagar only. So these are the indicators. This is status NFHS 4, and if we go for a comparison of this, in fact mortality rate, it has 16.1 points decline. Neonatal mortality rate, this is again 13.5 decline is there. This is total fertility rate, this has 0.2 points decline. Then sex ratio is there, this is 53 points improvement. Institutional births, that has again gone 92.4. This may be 1 month or 2 month old data, but if we go for a real time basis now, I think we had reached to 96%. Fully immunized children, that's 96.5%. Life expectancy, this has also increased as we see comparing both these studies. Then SDG performances. Yeah, all of us we knowing that we do have presently, we are implementing in all sectors, whether it's a health, education, environment, housing, urban realities, where we do have a set of these SDG goals, and this health comes under SDG 3 goal. There what we overall score of SDG goal increased by 8% during 1 year, from 62 points in 2019 to 70 points to 2022. Then achieved global target of reducing under 5 mortality rate to 25 per 1000 live births. Under 5 MR of J&K, 23% live births, national is 36. This is I think present present scenario. Achieved the target of 100% immunization for children 9-11 months. Institutional deliveries increased 94.60%. This will involve our this infrastructure development, research development, manpower management, and other things. I had referred to some slides, 1 slide or 2 slides, what we had been doing with regard to infrastructure first. Then I had shown the comparison. Now I'll be referring to the infrastructure, how much infrastructure is coming up in the J&K state. So you must be knowing that 500 bedded, that's already operational in Srinagar. Then 200 bedded veterinary hospital in Jammu. New Bones and Joint Hospital Jammu, 100 bedded emergency block at Jammu, construction Boys and Girls Hospital at Jammu, then construction Nursing College at GMC Srinagar, district hospitals 46 CHCs, SDH 29 PHCs, NDPHCs, and those 4 drug stores, then State Cancer Institute at GMC Jammu and Srinagar, these are under construction. Bones and Joint Hospital हमारा चल रहा है श्रीनगर में. आई डू बिलीव तो 2000 टारगेट जो है अगस्त का दिया हुआ है JKPC एग्जीक्यूटिव एजेंसी ने. देन ललदेन में हमारा काम चल रहा है, दैट्स गोइंग ऑन, दैट्स एडिशनल ब्लॉक्स आर. दिस इज augmenting the infrastructure level in the health sector. Then mobility. So this has eased out to very extent, not only the burden on the doctors, the administrators who are looking after their managing their hospital, these 108 ambulances. I think not only that, but it has also institutionalized the things. This has become an institution. So this is the latest, this is yesterday's figure. We had been, it says Kashmir based on 88,920 emergency cases had been that 108 has successfully implemented these cases and delivered to their dropped their residences. Then 5379 COVID cases have also been faring through 108. Then 102 ambulances, this has also been in Kashmir backdrop, they have been dropped back, that is 20,040. This is yesterday's figure, these are the yesterday figures. Then 104, this has been recently stated, and this is also linked to our this virtual move telemedicines, what we call it like that, this is also functioning. Then human resources, this is a very important and critical aspect with regard to the medical service. We need professionals for that. We do have, everybody knows that medical college, this is only, and I'm just refreshing the things. All of you know that we do have 5 medical colleges, Anantnag, Rajouri, Toda, Kashtwar intake capacity, and 2 colleges are more coming at Handwara, Kupwara, and that what we Udhampur. Then we do have one nursing college, those are also in place. Then research, we do have residency courses. All of you know that has been introduced in the district level, district hospitals. Then about 10 paramedic courses are going on in different colleges. Around 200 seats in diplomat DNB courses have been introduced, and I'm also part of in Srinagar as the chief planning officer. I'm also a member of this JNLM hospital for deciding about the sample size and other things with regard to their research. So this now there is another part that has been introduced, which we call it Ayurveda. The Bhadrava, there is a high altitude medicinal plant that has been institute has been established here, and also what we are witnessing in the field, the people from these Ayurveda are coming to us that just guide the people for guidance for planting the medicinal plants, for just getting those they will become the cash crops or something like that. There Dascoria is there or something, some other ornamental plants, or that lavender and other things, they are coming, and we are having the meetings with the district officers, and also with this what we call as stakeholders, rather agriculture, horticulture, is that you do have the horticulture there is already, you do have these orchards or something like that, but there are certain medicines you can go for their cultivation in those fields also. So working on this. So health and wellness, though this is a health and wellness, these are now coming to the modern health, what we are and where we need to go for the planning of these. Health and wellness, we know that clinically we are very sound, and everybody has recognized, not only recognized but appreciated, especially the Kashmir-based doctors during the COVID, the work which we had done, how we had treated our patients, how much instrumental we had been able to control the deaths. Though infections were there, but we didn't have more deaths. I remember the day when Salim Saab, Mr. Shahid Chaudhary, we used to visit in the wards where the positive patients were there, and we were visiting to their beds and inquiring about them. So that was a level of commitment from them. These health, we had been always having meetings on daily basis. Whatever will be the recommendations, advices from the medical side, we were the first district to implement all those. We were the first to plan how to go for this, what we call COVID management. Clinically, we had done wonderful. Clinically, we are wonderful. So, ab hum health and wellness centers. So, what actually health and wellness centers are? We had started a program in Srinagar district for health and wellness center with Dr. Salim Saab, and the lady Dr. Farah is instrumental in that, by the name of Zoon Pai. Zoon Pai. We had worked on that, and we are giving him funding also, because we're not expert how this is to be run or something like that. We don't have that expertise available. That's always with you. That's your privilege. You have to do that. So we had provided him the funds, and we will be establishing the state of the art during next year. Inshallah, we'll be coming up with these 4 these health and wellness centers in BMO Hazrat Bal's area. So what actually health and wellness starts? It's a preventive care. So I'll be referring to also this poor economics of this the book which has been written by this, what we call it, Nobel literate Dolfo and that lady that's Banerjee. So preventive, this is very important. Preventive care. So instead of going in the details, or rather going for these antibiotics and other things, let us start from the beginning. So we will suggest that preventive, that may have an effect. That I will come later on that. Then fitness and exercise, we know that this is very important. These play a very important part with the psychological balancing of a person. Then nutrition is carbohydrates and other things. But we were in a conference, I think 1 month before in Niti Ayog. So there was a presentation from Punjab. Everybody says that Punjab में कोई भूखा नहीं सोता. Nobody. Everybody does have a food. लेकिन वहाँ पे malnourished rate जो है, that's quite higher than us. उनकी जो malnourished rate है. What's the reason? उनके कार्बोहाइड्रेट्स प्रॉपर नहीं मिलते हैं. बट आई टोल्ड दैट गाय दैट व्हाई इट्स इन पंजाब. एवरीबडी से द पंजाब डज हैव अ वेरी गुड फूड. दे डू हैव नो, कोई नहीं, ये तो इट्स अ यूनिवर्सल फैक्ट है. पंजाब में गुरुद्वारे हैं, बाकी चीज़ें, तो सोशल सर्विस बहुत ज़्यादा है, कोई नहीं सोता without food. But why this is nourishment क्यों है? Biggest reason was they were not getting proper these carbohydrates, or what are the contents or mixture of that. उसके बाद में stress management. This will become a complementary with this health and wellness centers. How to manage the stress. This is a very vast topic, and you know better than me how to manage the stress. And we need some psychologists also. Those I'll be coming later on. How we had progressed on that. Then complementary and alternative measures, aquatherapy and other things, those can be a consideration for this. Then behavioral health, emotional and other things, those are to be covered in health and wellness, in addition to the clinical examinations. Then we do have till 2029 are the total health and wellness centers, and we have to make them operational. Today, as on day, we do have 2100, but I'm very I can say that apprehensive, or rather I can say like that, I do have a doubt what the basics are these being addressed in the health centers, the health and wellness center, that is to be seen, or this is a new concept and this may improvise. 2 साल 3 साल पहले सलीम साहब स्टार्ट हुआ था ये. सो इसके साथ आपका एक तो क्लिनिकल भी रहेगा, बट you have to involve those psychologists and other things for that. There may be some recruitments, there may be some appointments, तो वैसा, and also providing apart from this clinical equipment, clinical examination equipments, there are certain other equipments like gyms and other things. Those are to be provided. For that, we will be incorporating, which I already told, that we are going for 3 model these health and wellness centers in Srinagar. So for that, we had already created a margin, kept a margin for the next year, and we'll be funding that. Then future of health system. This is a very technical one, and not, I cannot say as an authority on this. You people are more better know what should be the future of health. But what I had analyzed from yesterday, what should be and what has been doing in the health sector. So it's an electronic health record system, which we know that this should it should be electronically available to the authorized this doctor, and he should be suggesting the tests and other things, what improvisations are required there. So he will be there. Then there are telemedicine and virtual consultations, which we had introduced. 104 is part of that, and we do have last year we got I will tell you, last year we got a lady from Delhi. She was with the concept that in Kashmir there is no concept of telemedicine. She came to our office that I'm going to introduce this. She was some NGO. Then what I did, I took her to the medical college and showed that room where the teleconsultations are being done, and to that area you may have been, some people may have been to that place. Tangdar is there, then we do have Karen is there, Matsel is there, Gurace is there. So from that place, she was completely taken by surprise that this has been introduced somewhere. I was not in service at that time in 2006 in medical college. So you are telling today. So it's now these are all, we do have everything in place, but now it's what we have to involve ourselves. We have to switch over to these things. These things have come to stay, and there is no option available with us instead of switching over to these things. Then integrated healthcare delivery system. Integration. What integration actually means? In integration, well, this is integration with the integration of everything. Everything means this is an environment is there, health providers are there, health providers, health facility providers, are health seekers, policy makers are there. Everybody, these are to be integrated with each other. So they do have one. We have to create. There is in management terms there are 3 terms. One is dependence, independence, and interdependence. So whenever we say dependence, what dependence actually is? Dependence is you are important. You can do it. That means you are important. I am nothing. Then independence, I will do it. That you are nobody. You are nobody. Now the third term, from the management point of view, what that has been that is very widely circulated. That's the interdependence. Let we do the things, not you and me. Let we do that. This should be an environment. It has to be made such a conducive and such a dynamic that it should merge with the environment, with all the aspects, policy makers, service providers, whether in the private sector, government sector, then animal health care, or anybody, wherever it comes. So at the end of this, after the integration, or whatever the facilities, or whatever we are going with the integration, this will help, and this will give us this will make us healthy and have a more life expectancy. This will increase. Then we have emphasis on patient-centered care. So this is, again, I will be in a general terms, patient-centered care. Patient-centered care, what that actually is? Patient-centered care is that we have to take the patient into confidence, this sense of belongingness. I can say like that, sociologically or psychologically. Patient-centered, and we have to analyze him or give him a margin as per his requirements, as per his needs. We make a treatment as per his requirement, as per his needs, as per his financial wealth has to be taken into consideration. That the financial status of the person has to be consideration, but at the same time we should not compromise with the quality, because there are alternatives available with us. To treat a person from that point of view. Then prevention and wellness. So before going for antibiotics or something like that, we have to advise, rather nudge the person. It should be nudged. So what Banerjee somewhere says, that what he says, he says that in developed countries, what actually there is, what they do have at every facility, every corner, the silent nudge. They give silent nudge to their population. So dispenser is placed. dispenser, there may be a chlorine on the other side. It can be like that. So there's a nudge that this is you need safe drinking water, so it is chlorinated. It can be like that. So prevention and wellness. Wellness means we have to increase the extra these activities, what we call it, the gyms, walks, counselings, consultations, have debates, and then there is a happiness also. You can share the happiness class. Happiness also. On happiness, I'll be adding one more point. I was studying Delhi model of school. I was recruited by the government to study Delhi model of school. They had one class for the kids that was called happiness class. What actually happiness class was? It was not that they play games or something like that. Kids when got in the room, they were told whatever you want to do, break anything. आप कमरे में जाइए, आपने जो करना है 25 minutes का उनको मार्जिन दे देते थे. Whatever you want to do, whatever. It was not playing football or something, so structured games or something. No, go in the classroom, play with yourself, fight with each other, break something. Whatever you do, nobody will ask you with regard to that. This is in happiness, I can say like that. That can be a part of this. Then is interdisciplinary. Interdisciplinary is better than that specialists will meet each other. They will do with each other. Specialists, then we do have what we call it in health. There are number of specializations and number of courses and number of specializations. They will coordinate with each other to come in conclusion, which is very authentic or which can guide the future generation, future doctors, and some to implement on that. That focus on quality improvement and patient safety. That becomes very important. That patient safety is. Then this is your the latest what we had a National Digital Health Mission. This has been introduced, and you had gone for this. Health IDs, every health that purpose unique identification has been. I do believe that this has been issued and is in a process in issuing respiratory health professionals involved in delivery of health service, enabling them to get connected to the India's digital health. Then respiratory health facilities nation across the different systems, medicine, public. Then an electronic record system जो आपका अपना है, जो हम भर रहे हैं आज, मतलब आज पोर्टल है, तो हम अभी एक पोर्टल से अपना रिकॉर्ड आप भी पढ़ते रहते हैं, तो हम भी वो पोर्टल्स पे आचार है मेरे साथ समथिंग लाइक दैट. लेकिन आपका व्हाट आई हैड हर्ड कि आपका सेपरेट सिस्टम है, यू आर देयर रजिस्टर्ड देयर. देन इलेक्ट्रॉनिक मेडिकल tracking of the records of patients and other things that you know better than me. You have been in this. Then there is a social determinants of the health. Social determinants, what these are actually, you will see there is a health, community is there, finance is there, housing is there, then urban realities are there. You can be going this urban realities. How Srinagar, we do have a population as per 2011, this is 12.56 lakhs. So how the area is we do have a very high density in Srinagar, and we don't have spaces to address these space constraints. What is to be done? So Srinagar, what we had done, we had constructed some, though we don't have a social culture like that to celebrate our functions, whether it's a marriage or anything, we celebrate our home, but we had been able to come up with some these community halls, some 200 community halls, and 50 are under construction, but 200 we had handed over to the municipal corporation. They are running them at the different locations. Then we have a construction of drainage. Srinagar does have a, presently if we see 2035 तक हमें जो श्रीनगर में चाहिए, हमें 1500 किलोमीटर चाहिए. 1500 kilometers of drainage network Srinagar में चाहिए. Presently, what we do have only 723 kilometers. So address this. This has to be taken into consideration. हम इस पे काम कर रहे हैं. We got a funding because resources are always limited, and this has to be what we call it, spread over 3-4 years. So there comes the prospective planning. This is our priorities. We'll be concentrating on certain areas where there is the drainage issues are more serious than the areas where we don't have such issues in the drainage. Then we have a sewerage. Sewerage is going on Srinagar. We need 2023 तक हमें 1100 सीवरेज ये नेटवर्क चाहिए. दिस ईयर विल बी कमिशनिंग दैट स्कीम, एंड पूरा डाउनटाउन जो ग्रेटर श्रीनगर हमारा है, दैट विल बी कवर्ड इन दैट. Then establishment of old age homes. I am touching this with regard to this social constraints. Old age homes, those are day by day becoming very important and very, 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 very effective within the Srinagar. We had only opened one at Eidgah and we are getting on daily basis very good response in that. People are coming and they are telling us, now give us the place. So I belong to this society and you belong to this society also. There are applications coming to us that kindly create a night stay facility also there. This is a daycare. There are parents, there are people who are coming to us that telling that they create a night facility there. So this has to be seen. Then open air gyms, we made an initiative, some 20 open air gyms we constructed, but this is not the end. Much more is required with regard to open air gyms. We had constructed somewhere in downtown is there, रावलपुर एरिया में है, राजबाग एरिया में तो है ही पहले से, बट छोटा सा इन्वेस्टमेंट है 2.5-3-4 लाख का एक ओपन एयर जिम के लिए, उतना बड़ा इन्वेस्टमेंट नहीं है. सो वी आर प्लानिंग फ्रॉम द नेक्स्ट ईयर विल बी going for massive involvements in these things. Then establishment of grievance mechanisms. We do have a we are rated at, Srinagar is rated at serial number 3 at the national level with regard to redressal of grievances. We do have a very wonderful mechanism with regard to that. We do have around about 80 people working in the grievance redressal, this what we call it cell. And now this is switched over to ICCC. This will be switched over this year, Integrated Command and Control Center. And we in factly on trial basis we run that during that sir, इसमें जब अमरनाथ में हुआ था वो क्लाउड बस वहाँ पे जो हुआ था उसमें हमने वो रन किया हुआ था. एंड इस सलीम साहब वगैरह जो CMO साहब हैं वगैरह, मेडिकल कॉलेज वाज विद us with regard to that. We are able to track the people on real time basis. So that is there. Then I will be going to the education. The system of education has completely come. This has completely changed. Now this is outcome based. People are not rated on this classes or something like that. And in Srinagar is very difficult. What is in Srinagar? एजुकेशन सेक्टर में अगर हम देखें, एजुकेशन सेक्टर में हमारी जो पॉपुलेशन है 83% जो है दैट्स इन प्राइवेट स्कूल्स, दैट्स इन, एंड ओनली 17% जो है हमारे पास है वो हमारे गवर्नमेंट स्कूल्स में है. सो इस साल से हमारा क्या, हम पिछले 2 सालों से वी आर रेटिंग स्कूल्स ऑन द लर्निंग आउटकम्स. And slide is not, I don't believe slide is here. मैं आपको दिखा देता हूँ. Last 2 years, 3 years, we are working on that learning outcomes. What had been the learning outcome of the kids at the 5th, 3, वो NAS आ जाता है, वो सर्वे आ जाती है तो वो हमें दे देता है, उसका डाटा दे देता है. And we are improving, very much improving on those parameters. And we do have, I can say this is a very, the trend, this is a positive trend that we do have enrollments also in the government schools now. इंक्रीज़ हो रहे हैं, हमारे डे बाई डे इंक्रीज़ हो रहे हैं. एंड श्रीनगर में सबसे ज़्यादा जो एडवर्सली इफेक्टिव है दैट्स अ प्राइमरी सेक्टर. 9th तक आप सभी लोग जो है ना प्राइवेट स्कूल में पढ़ते हैं, लेकिन 9th 10th पास हो गया तो यू विल शिफ्ट एंड गेट द एडमिशन इन दिस व्हाट वी कॉल इट कोठी बाग और समवेयर एल्स और SP कॉलेज एंड देन सिट एट होम एंड प्रिपेयर फॉर दीज कॉम्पिटिटिव एग्जाम्स. तो वहाँ पे इनरोलमेंट बहुत ज़्यादा है. तो जो हमारा प्राइमरी सेक्टर इसमें कुछ कंस्ट्रेंट्स हमारे, देयर इज एन फाइनेंशियल कंस्ट्रेंट्स है, देन देयर इज एन साइकोलॉजी ऑफ द पेरेंट्स हैं, बाकी चीज़ें उसमें हमें दिक्कत आ रही है. फॉर दैट व्हाट वी हैड डन when we were studying this Delhi model of the school education, तो इसमें क्या था कि they gave the name of smart schools. What actually smart school is? We just studied that for 15 to 20 days. हमने उनके साथ स्टडी किया, उनका क्या सिस्टम है, कैसे चल रहे हैं, वो क्या कर रहे हैं. We just came and implemented it here. और can you believe we do have 125 primary schools जिसका प्राइवेट स्कूल्स से बेस्ट इंफ्रास्ट्रक्चर है. उनकी चेयर्स, उनकी बेंच, उनका दिस IT इंटरवेंशंस, उनकी ये जो अपने हैं लैब्स जो हैं छोटी या ओपन लाइब्रेरी जो रखी हुए हैं हमने उनकी, 125 स्कूल्स हमने श्रीनगर में ऐसे एस्टैब्लिश किए. दैट इज हाउ है. अगर प्राइवेट स्कूल्स के बराबर नहीं है, लेकिन प्राइवेट स्कूल ऐसे कम नहीं है. उनका फर्नीचर दैट्स अ वेरी मॉड्यूलर फर्नीचर, बिकॉज दिस गिव्स अ डिफरेंट. मुझे अच्छी चेयर, पहले बच्चे को अच्छी चेयर दे दें तो दिस गिव्स अ सेल्फ दिस ना कॉन्फिडेंस आ जाती है, थोड़ी सी कॉन्फिडेंस आ जाती है. So that we introduced it, but we are working on that. Switching over to eMood. eMood हमने एक प्रोग्राम भी कर दिया. अब we had come up with an app also. That's by the name of Gosh by एजाज साहब जो हमारे डिप्टी कमिश्नर आज हैं, उनका वो इनिवेटिव रहा है. दे ही गॉट एन अवार्ड ऑन दैट आल्सो, नेशनल अवार्ड में गोल्ड मेडल उस पर मिला हुआ है. दैट्स एन ई लर्निंग उस पर भी हमने अब पीछे तो हमारे दैट वाज ट्रायल बेसिस, बट फुली वी विल बी इम्प्लीमेंटिंग सम 200 schools will be covered under the ambit of that program. So हमारा ई-क्लासिंग में that you will tell and you will solve the problem. That's some IT program. I'm not too much well versed with the IT, so I'll not be able to explain, but there is a program on that. Then environment. Now, environment is the biggest challenge for the future generations to preserve and to do justice with this. What we had been so basics. जब हम इसमें चले जाएंगे छोटे छोटे मसले मैटर करते हैं. Then you do have a rejuvenation of water bodies. जो आपकी पुरानी water bodies हैं that has to be rejuvenated. हम श्रीनगर में बात करूँगा. आपका गिल सर और खुशहाल सर. Maybe somebody may be residing in around that Gil sir and Khushal sir. What we had done, we had cleaned them during these. Last year हमने उसका प्रोग्राम लिया हुआ था. Those are अब somebody told me there that after 25 years उनको क्या बोलते हैं वो डक्स वापस आ गई हैं उसमें. People are very happy with regard, but those have been, there had been encroachments, other thing, we removed that, we cleaned mucks and other things, cleaned that, those are there. And then there is everybody may remember his childhood. जब बचपन में ना वो छोटे छोटे चश्मे हुआ करते थे वैसिनिटी में, छोटे छोटे चश्मे होते, वो सो पोल्यूटेड, इतने गंदे. मतलब आप certain those what we call it, those springs have completely abolished, है ही नहीं कहीं. And one of the examples is हमारी भी उसमें, I was chief executive officer लोलाब डेवलपमेंट अथॉरिटी, टूरिज्म डेवलपमेंट अथॉरिटी. सो लोलाब का आपको पता है, लोलाब में पानी है नहीं. लोलाब डजंट हैव अ वाटर. लोलाब का जो पॉन्ड्स थे, वी जस्ट स्टार्टेड टू टच देयर आउटर पेरिफेरीज. उसका क्या हुआ, उसकी रगें खत्म हो गई, द फ्लॉप वो खुश्क हो गए. देन वी हैव टू रिजॉर्ट टू अदर थिंग. दूसरी जगह खोदने के बाद वगैरह वो फिर रिजुनेट करना पड़ा. सो इसके साथ जितना कम छेड़ा जाए चश्मों के साथ, उतना ये प्रिजर्व करते हैं. बट वट वी हैड डन, दीज आर नाउ इन श्रीनगर, वट वी हैड ड्यूरिंग दिस ईयर, वी हैड रिजरेक्टेड सम 75 स्प्रिंग्स, ओल्डेस्ट स्प्रिंग्स. इसमें आपका ये एरिया भी आता है, ये अपना जो है जीठिया टेम्पल वाला, या उसके साथ में, या फिर अपना हार्बन एरियाज़ में हैं, या फिर अपना इसमें डाउनटाउन में भी कुछ जगह हैं जहाँ पे हमने इनको किया हुआ है. देन इन्वायरमेंट, देन कवरिंग आउटसाइड फॉरेस्ट एफॉरेस्ट्रेशन है. आउटसाइड फॉरेस्ट एफॉरेस्ट्रेशन, दैट्स वेरी इंपॉर्टेंट, फॉर विच 4.82 lakhs हमने उसमें किया हुआ है. वी आर एडिंग मोर टू दैट. दिस इज़ देन इकोनॉमिक, जो उसका आस्पेक्ट है सोशल कंस्टेंट्स में. इकोनॉमिक आस्पेक्ट है. इकोनॉमिक में आप देखेंगे हमारी मेजर इकोनॉमी जो टूरिज्म है, एग्रीकल्चर है, या फिर इंडस्ट्रीज अब जो है स्विच ओवर हो रहा है. वी डू हैव एन इंक्रीजिंग ट्रेंड्स फॉर लास्ट 3 years. सो फ्रॉम दिस पैरामीटर वी आर आल्सो वेरी गुड ऑन दैट. सो पीरियोडिक इनिशिएटिव्स फॉर ए हेल्थियर वर्ल्ड. अब इसमें पीरियोडिक इनिशिएटिव्स फॉर द हेल्थ, दिस इज व्हाट आई जस्ट वांटेड टू कन्वे. देयर इज अ डायरेक्ट रिलेशनशिप बिटवीन environment, what we call it, relationship between environment, development, population and health sector. इन तीन चीज़ों का बड़ा आपस में बात, these are very interrelated and these three things are to be very much addressed, या इनको हमें कंसर्न, इनको हमने अकाउंट फॉर करना है, तभी जाके हमारा जो है हेल्थ का फ्यूचर जो रहेगा, that will be conducive to us, that will be help to us, that will help us to keep ourselves healthier, and जो हमारी फ्यूचर जनरेशन है उनके लिए भी ये this will be a positive step for the future generations. So how integrating health into development plans, health, how to develop them. जब हम ये health का नाम ही लेते हैं तो developmental plans, अब pollution है, we do have a national clean air program presently going on in Srinagar. We had invested some money in it, and we will be investing more money in it. We had these pollutions from the roads, from the factories, from houses, or from anywhere else, but we are monitoring it, and there is a proper mechanism which is being placed. Within 2 years we will be able to have a complete mechanism on this air pollution in Srinagar, and how to control it, and it will be, I don't think so. Personally, I don't think so. There had been an increase of 1.24. It was last year, and now it has come to 100. But वो रहा है किस वजह से रहा? This was not a man-made intervention. There were vehicles were off the road. 2019 और 2020 का comparison है. तो because vehicles were off the road, so that वो pollution level जो है that has come some 24 points down. इस साल का अभी comparison data आया नहीं. तो उसके बाद में आपका जो है strengthening health systems. How to strengthen the health systems. हेल्थ चैलेंजेस जो है इन्वायरमेंटल डिग्रेडेशन की वजह से हमें होते हैं, या बाकी जो एनिमल्स वगैरह है, या उनकी वजह से हम उनको प्रॉपर केयर, हेल्थ केयर नहीं दे पा रहे हैं फ्रॉम एनिमल सेक्टर. सो वी हैव टू बी टेकन इनटू दैट आल्सो इनटू कंसिडरेशन व्हाइल एड्रेसिंग, व्हाइल पीरियोडाइजिंग आवर हेल्थ ऑब्जेक्टिव्स एंड गोल्स फॉर द फ्यूचर. उसके बाद में हमारा जो देन इम्प्रूविंग एक्सेस टू द क्लीन वाटर एंड सैनिटेशन. क्लीन वाटर सैनिटेशन, इसमें सिंपल व्हाट वी कॉल इट क्लीन वाटर तो चाहिए, सैनिटेशन भी हमारा चाहिए। इसमें हमारा, आप तो जानते हैं कि गवर्नमेंट की 2 स्कीम्स चलती है, एक हमारा स्वच्छ भारत मिशन अर्बन भी चल रहा है एंड रूरल भी चल रहा है। तो श्रीनगर जो अर्बन जो था, अर्बन में डोर टू डोर कलेक्शन स्टार्ट हो गए, बट इन रूरल वी हैड इंट्रोड्यूस्ड एंड आवर इन श्रीनगर वी डू हैव 21 panchayats in rural areas where we had started this with the local mechanism, charging some 100 rupees to per house, and they had developed their own mechanism. We had identified the sites and they are dumping there. So this has to be bought in a sustainable mood. It should continue. It should have a continuity. It should not be 2 years, 3 years we are pushing that. It should after 1 year this will again stop working. They should not be like that. Promoting healthy environments. So healthy environments, this is physical activity, the healthy diets and other things, those have to be, that's again a wellness. These are all interconnected with this. Then gyms, then with counselings, then psychological balancings. Then there is a then this building disaster resilience. अगर रेट किया जाए तो SMHS सब वन ऑफ द मतलब वर्ल्ड का सबसे बेस्ट जितना इसने ये ट्रॉमा को फेस किया होगा. I don't think so any other hospital should have faced such huge things with regard to that. So we have to prepare our society and our resilient system भी वैसा हो जो respond करे. And 2014 we knew अगर किसी और जगह सैलाब आया होता, we people are we are also very helpful in other things. We did our own jobs. We went, अगर हमारे घर में पानी आया था, हमारे अपना घर छोड़ के दूसरे घर में चले गए, उसको बचाने के लिए चले गए. These were the example is set. 2014 का flood has proven that it's not a dead society. They can help. They go to the help. So resilience very important of the stakeholders of the health sector. Whosoever these integrations. At the end, I will tell in nutshell there is an integration has to be done. उसके बाद में आपका जो है building supporting research and monitoring, that's very important. Research, without research आप तो रोज research papers लिखते हैं. I do have some friends as doctors. उनका अक्सर रहता है कि 2-3 रिसर्च वगैरह पेपर्स निकलते हैं, and we'll be concentrating on that, and that's very important. Identify the shortcomings, corrective measures are to be taken, future strategies क्या रहेंगी, and on these efficacies and other things, those research go on, and that has to be continued with regard to this. Then engaging the stakeholders. Stakeholders, again, I will come in the community, health providers, health service providers, then there is government agencies. These are to be integrated together. The relationships between the environment and development population, these are to be taken into consideration while designing any future strategies for the health. One thing is there are certain 3-4 points which I will be referring to the health sector, which is very instrumental while shaping our future policies with regard to health. Whenever we see there is a promise, but at the same time, there is a frustration in the health. There are certain low-hanging fruits that can be a preventive one. Just like that, what we call it, कोई बीमार आता है, उसको डायरिया हो गया है, ORS देना है, मलेरिया हो जाता है, तो उसके लिए एक नेट चाहिए, वो जो मच्छर से भगा सकता है, isn't that? तो ये जो है ना, यहाँ पे these are called the low-hanging fruits. So at the initial, what we have been doing, that we have been blaming the doctors that they are not doing well. But there's a mere frustration. It's a promise and also mere frustration. Why there is that if somebody comes with his kid that डॉक्टर साहब मुझे इसका ना डायरिया हो गया है तो इसको आप कुछ दवाई दे दीजिए, so आप ORS दे देंगे, so he will not believe you. What he will do, no मुझे antibiotics दे दीजिए. So that becomes a frustration. There's a conflict between the patient and that. Number 8. So these are called the low-hanging fruits. How we will be analyzing, how we will be putting our people, the future generation, towards that. Usme, these become the basis. Number 2, there is what we call it, faith. I'll be quoting an example. A person got married in Bombay. He was from West Bengal. Do you know what West Bengalis eat? What they eat? They eat there's not rice, isn't that? अगर वहाँ किसी को फेवर हो जाता है वेस्ट बंगाल में ना, तो चावल बंद हो जाती है, बिकॉज इसका फेवर डाउन आ जाएगा. हमें यहाँ भी बोलते हैं, मेरी माँ भी मुझे बोलती थी, अगर ताफ खोते हैं इसको चावल नहीं देने हैं. बट शी गॉट मैरिड टू महाराष्ट्रन लेडी. महाराष्ट्र में कोई चावल खाता ही नहीं है. एंड व्हाट हैपन्स देयर, अगर महाराष्ट्र में किसी का फेवर आ जाता है तो वो चावल पहले स्टार्ट कर देते हैं, इसको चावल दे दो. So these beliefs have to be balanced and these beliefs have to be addressed. अच्छा, ये तो हमारा मतलब these are we call it developing countries. Measles, what's happening in Europe? But US and UK people, they don't allow their kids to, their children to be that given vaccination against the measles. Why? वो कुछ वो what they are explaining, they say that if we give these measles के लिए क्या कौन सा टीका लगता है, क्या इंजेक्शन लगता है, अगर हम वो दे देंगे, he will be shy, he will not be able to communicate, he will not be a socializing person later on. और आप देखेंगे अगर आप if you go by the research papers, आप US को देखेंगे वहाँ measles का ज़्यादा आ रहा है, रेटिंग ज़्यादा हो रही है. So these are what we call the faiths. These are the faiths. Then if these are I have put some points there. उसके बाद में आप देख लीजिए miracles, जो मैं अभी बात कर रहा था, what miracles are. Miracles ये why these are underutilized. यार preventive है. Preventive miracle यही है कि ORS देना, ORS से ठीक हो जाएगा. This is very cost effective. Isn't that? उसके बाद में आपका ये क्या बोलते हैं अपना some research has been done in what we call it ये अपना क्या बोलते हैं ज़ैम्बिया साइड में, साउथ अफ्रीकन कोई कंट्री थी, उसमें वो रिसर्च हुआ था, वहाँ पे नेट दे रहे थे फ्री ऑफ कॉस्ट, और फिर कोई सब्सिडाइज रेट भी दे रहे थे वो मीजल्स इनके लिए ना मच्छरों के लिए, वो नेट्स वगैरह दे रहे थे, या फिर ये जो है एंटी डिफेकेशन या वो एक वो दे देते थे, कमोड एक दे देते थे, या फिर उसके साथ एक पाइप भी दे देते, अभी भी दे देते, हम भी दे रहे हैं यहाँ पे इस एरियाज में, श्रीनगर में भी, JNK में भी वो हो रहा है, वो दे रहे हैं. बट वो अब दिस वेदर दिस सब्सिडीज आर दीज प्रोवाइडिंग दीज थिंग्स, आर दे इफेक्टिव इन द हेल्थ सेक्टर? That has to be seen. Some say it has backfired. Some say that these nets have been used as veils, wedding veils, in this now what we call it African country, some African country, or these what we call it these what we are giving the commodes, they had been flower pots उनको बनाया गया है. So these there is a contradictory research on that, but again this space. But again, there may be 30%, 40% may be like that, but 70% is not backfiring. Subsidies are not backfiring, they are providing something to that one. Then, when we say this is health gets a person, the bad health or poor health gets a person, what we call it, poverty trap. How it goes? Poverty trap में कैसे आप फंस जाता है वो? Person, he is not feeling well, he is ill, and he doesn't have why he is ill? He didn't got the proper food, proper facility at the childhood. Whenever we provide a child proper facility, proper food with nutrients and other carbohydrates and other things, he will be healthy at time, and when he becomes an adult, he will earn more. So he will be more productive than a person who is continuing with that disease or something like that. He is sick. Or in his family, it's not that everybody cares his health. Is a poor person, he also cares about health. Why? He cares about health. But at the same time, when the burden is so big that he is himself ill, his wife becomes ill, his kid becomes ill, so he becomes it's a pure fantastic trap. He goes in a trap, and he later on he becomes he is a poor because of the health. Because the basic is that the health, he becomes a poor, this adds on to his poverty, and he is in a trap, he doesn't come out of that. So that health plays, and health has to be taken care right from the birth of a kid. Nobody is knowledgeable enough to take care of his personal and take the right decisions about his own health. What is there, what the developed countries are doing, what they do have, they keep that nudge available to their population so that they are made aware about the decision making vis-a-vis to their health. So we have to introduce also those nudges, which we had already quoted the examples, how to proceed, that there may be water dispensers there, chlorine have to be kept there. And the drainage system, but this has to be a nudge with regard to that drainage system, how it functions. We know that drainage goes out, but we don't know how it goes out. हमें पता ही नहीं है कैसे जा रही है बाहर. So from that point of view, we have to be these little interventions will help us to improvise health, plus the advanced, which I had shown, that was a structured one, which I had shown in the presentation, that was purely structured one, and by making those interventions for the future generations of this particular universe, you people are not serving to if your research space is not for Kashmir specific or India specific, it's for the universe. They accept your papers. That's applicable throughout the universe. That does have a value for that. Anyway, thank you very much. Thank you, Srinagar. Thank you, sir, for inviting me for this lecture.
I had the feeling that I am just in a classroom listening to some great teacher talking about health planning and management. It was all the things which very relevant and pertinent to our health system, and definitely this is something, it's beyond theory, because whatever Yaseen Saab has told is what is actually being done. So we might have heard people or teachers talking about health planning and other things, but this is something which actually has been dealt with and which is being implemented so that we improve upon the health, especially once we talk about the social determinants of health. We have read in books, but once we saw the presentation, the real indicators which affect our social aspect of health and all those things and what things need to be done in health sector on the social front have been dealt very nicely. So with this we come to the end of this today's guest lecture. So it was with much difficulty that I was able to get Yaseen Saab to this place. He was very reluctant, but somehow I succeeded it. I wasn't even sure enough at 2 p.m. today, but somehow he called me that he's at GMC Srinagar itself. Speaker, that he spared his time, and I know how he managed to spare this.